Hello, my name is Rachel Kapler, and I'm a newly hired Director of Performance Improvement. Today, I will be discussing the training workshop for Brownville Memorial Hospital. Our objectives today are to talk about health literacy, patient expectations, and the patient satisfaction scores. Okay, so we're going to talk about Press Ganey scores. What are they? They are the way that the hospital systems determine patient satisfaction. It's a survey that is given at random to patients and families and asks specific questions regarding their care. It is distributed among different themes from nursing, provider, housekeeping, and etc. on a scale from poor, fair, good, and excellent. These scores show a number of opportunities for leadership and staff at Brownville Memorial Hospital. Patients and families gave Brownville Hospital a poor rating when asked about their understanding of health information. There is an obvious frustration related to the deliverance and communication regarding health information and education. So we're going to talk about statistics. So what is the percentage of foreign-born, non-native English-speaking patients that we see here at Brownville Hospital? 35%. On average, how many of our patients did not graduate from high school? The answer is over 30%. The national average is 83%, and even less for minorities. There are direct correlations between education, poverty, health literacy, health outcomes, and wellness. According to health literacy expert Helen Osborne, patients on average generally read 5 grade levels below their last achieved education level. An example of this would be that a person who had only achieved an education level of a freshman in high school, which is 9th grade, can usually read around a 4th grade reading level. So health literacy, it's multifactorial. There are many components that affect one's ability to understand health. So education, have they gone to school at all? Did they graduate from high school? Age, are they a small child or an elderly person? Poverty, low socioeconomic status is associated with higher health problems in relation to low health literacy. Emotions, did they just receive a fatal diagnosis or lose a loved one? Literacy, can they read and write? Culture, are there different words and different things that mean different things in different cultures? So things that we say here in the United States don't always apply to different cultures, and it makes it hard for them to understand. Next is going to be language. Do they speak English? Does ICU mean I as in a physical I, CU, or something else? And then disability. Is the patient physically or mentally disabled? In a YouTube published by the American Medical Association Foundation on Health Literacy, there were multiple real encounter stories in which patients are unaware of health information and the impact that it has. One woman got an entire hysterectomy and didn't realize that that was the procedure she was consenting to having. She was a young, talented professional who had no children. Another story was about providers who they had found that a patient needed to take a small green pill every day for their heart, but the patient didn't know what the name of the medicine was or exactly why they were taking it. The patient then stated sometimes they would forget to take the medication. Then the provider asked if they had high blood pressure. The patient responded and said that they know they have a problem with their blood pressure, but they didn't know that it was high. Then the provider asked if the patient had hypertension. The patient thought that that meant to be hyper, to be hyperactive with your energy levels, and didn't think that he had hypertension. So the provider says that, did you know that hypertension and high blood pressure are the same thing? The patient responded no, and said he understood why the medical team kept asking him recently when he was at a visit if he had hypertension, and the patient kept answering no because he didn't think that he did. So the U.S. Civil Rights Act of 1964. So health professionals are responsible for bridging communication gaps with patients who speak other languages and come from other countries. Understanding health information is a shared responsibility among caregiver and patient. Health professionals are responsible for bridging communication gaps with patients who speak other languages and come from other countries. This is a shared responsibility between caregiver and patient, as well as staff and leadership within this hospital organization. Not abiding by this policy is a violation of the law and in providing ethical patient care. There are national campaigns that are to increase health literacy among all Americans by the year 2020. So we've got 2 focused goals for improvement. So as a result of our analysis, the Press-Ganey scores in the Civil Rights Act, Brownville Hospital will target 2 specific goals to enhance health literacy among our patients and staff. The first will be clear communication with patients and their families. The second will be address language and cultural differences. By law, all health entities are required to use interpretive services for patients and their families. Using the Teach-Back method, interpretive services and ensuring communication patterns are reflective of patient needs will ensure that families understand health communication. It is ethically wrong to not ensure patient understanding of health messages because it can lead to harm. So how are we going to do this? So clear communication with patients and their families. So there's a couple ways that we can learn about. So body language, creating an atmosphere that is optimal to delivering health information, using nonverbal language and being present, sitting with families and their patients while having health conversations, maintaining good eye contact, and looking at the patient and not the interpreter. What is your body language telling you? The use of basic phrases. It is important that when you're delivering health education, that things are stated simply with avoiding the use of medical jargon. Simple wording. What does it mean to take medication on an empty stomach? An empty stomach can mean different things to different people. When this saying is used in the medical field, it means to take this medication 1 hour before meals or 2 hours after meals to ensure medication effectiveness in the stomach. Many medical mistakes have occurred from the misunderstanding of this simple information. Mistaking medications can lead to harm, and it is our duty to recognize this. And last, Teach-Back method. Have you as a provider allotted enough time to provide patient education? Did you ask the family in a kind, confirming way to explain to you what you have taught them? The Teach-Back method is best practice when providing and disseminating health information. When asking if the patient and their family member understand the information, it is important to use open-ended questions. So now to address language and cultural differences. So the use of interpreters. Use in-person and telephone interpretive services. This will ensure that not only the act of abiding by the law, but giving patients a voice in their care. Families often use friends and neighbors for the use of medical translation. This is harmful because there is no way for the health provider to know what messages are being delivered by the interpreter. This can lead to personal bias and lack of understanding of the healthcare system and medical language. This can create confusion and can possibly lead to harm. Finally, translation. So we need to provide educational materials written in commonly used languages. When speaking with an international patient, it is important to understand the cultural differences in health system and what it means for them to be healthy and to have good health. When I was in Africa, many people thought I wasn't healthy because I didn't have the characteristics of being overweight by body mass index standards. However, knowing that in Kenya a sign of health and wealth is to be plumper and not to be thin, their thinness is a sign of malnutrition and poverty. So another useful technique in providing patient education is the use of storytelling. Okay, so for our workshop. So the exercise will include a pre-knowledge quiz about cultural competence and health communication strategies. Then the first part is a group exercise with an interpreter and patient volunteers on discussing different health topics. Then there will be a quick education piece to identify opportunities from the first part to then lead to the second Teach-Back group exercise. Then a post-quiz will be used to determine the knowledge from the workshop. So our key areas of concern. So health communication key points. What are the patient priorities from the health team? Implementing effective education and communication strategies, including the Teach-Back method. Establishing rapport. Patients are more likely to listen and engage with you if there's an established relationship and trust, and the use of plain language technique. Cultural competency. When and how should a healthcare provider use an interpreter or a translator? What are the cultural expectations in receiving healthcare at Brownville Hospital from a patient perspective? And what do you think it means to give culturally sensitive care from a healthcare perspective? So the things that we'll need to carry out this workshop include visual aids, paper with quizzes printed for pre and post tests, pens, volunteer interpreters and volunteer patients, an educational component, a physical space with multiple tables. By following the Centers for Disease and Control and Prevention, they have provided a few key principles and professional development workshops, including sustainability of education, collaboration among health providers. The design is to ensure sound educational tools that promote public health, promotion and providing consistency, the delivery of education to be interactive and given with enough time, follow-up to determine success of education and to encourage growth, and evaluation of the program to highlight needs and improvement strategies. I expect that this short exercise there will be a newfound awareness of cultural difficulties and health literacy among our patient populations at the hospital. I believe that this will be a direct and diverse way of educating staff members on the basic information of what it means to be in a complex health setting as an immigrant and what it means to communicate effectively. It will be more challenging for the health team to discuss work in groups with an interpreter or volunteer patient and the development of the 3-point education conversation. There will be an increased awareness of patient language needs, literacy needs after this workshop. There will also be an increased self-awareness that will be evident by the quiz results before and after the workshop. I expect there to be an increased effort in understanding the needs of each patient and providing health education, clear communication, and delivering cultural competence. So, Step 1, knowledge assessment. So there will be a quiz at the beginning of the health workshop to determine communication and cultural competence consisting of 7 questions and multiple choice. There will also be a quiz at the end of the workshop to determine effectiveness of workshop components. There will be the same questions for the post-quiz. So this will allow developers of the workshop to understand what the hospital knows right now about cultural competence and effective communication as to what they'll learn from this workshop. So the interactive group exercise. There will be 8 different common health topics that will be explored. Each group will be at random and given a health topic and told to provide culturally competent, clear communicative health education. Topics are healthy eating, smoking cessation, wound care, medication administration of lisinopril, asthma, gastroenteritis, vertigo, and concussion. There will be basic information about each condition on the cards that indicate which group will provide education on each topic. Then there will be partnering with a patient volunteer or a medical interpreter. These 2 volunteers will assist the medical team in developing the education and will show the cultural patient perspective. There will be 5 minutes total time to create 3 focus points to discuss in the delivery of health information. This will be presented in front of everyone after the completion of the exercise. So, rules for 3 key teach-back exercise. So you'll be divided into groups of 3 to 5 people. There will be either an interpreter, a patient representative with each group. You will be given a random health topic. You will have a total of 5 minutes to discuss the 3 most important pieces that you wish to communicate with your patients and provide reasons why. Then you'll present to the class the 3 most important communication components you chose to provide in educating a patient displaying cultural competence and clear communication. So the education session. So the expectation from this educational session is to regroup and refocus the lessons learned from the quiz results in the interactive workshop. Once the barriers to communication patterns have been identified, the quick 5-minute lesson on teaching quick, easy, plain language communication tools for education and conversation will be explored. There will be a quick recap of what cultural competence is and why it is important. There will also be a section on the teach-back method as to the new way of evidence-based education and how to use it. I believe with this workshop, Brownville Memorial Hospital will be able to provide competent cultural education in which language barriers and health literacy can be overcome. Thank you very much.